Good morning, friends. I am Dr. Kamaljeet Singh, Professor and Head of Department of Ophthalmology, Motilal Nehru Medical College, and I shall be discussing about coronavirus. It's so important to understand the problem. I have gone through some of the literature that I will be discussing. One is from the American Academy of Ophthalmology Alerts, and the other one is from the European Center for Disease Prevention and Control from the ESCRS website. Then Indian Journal of Ophthalmology and the International Journal The Eye. So these literature I have seen and I have come across some facts that I would be presenting here. As we all know that there is a pandemic going on of COVID-19 virus, and that is causing a lot of problem. And what we have to understand is that the statistics is today about 1.5 lakh cases have already been reported, and total deaths is around 5,700 till 15th March 2020. There are countries who are reporting it, others are not. 143 countries are reporting. And the problem can be gauged from the fact that USA has already had around 68 deaths till date. So it's a global problem, it's a massive problem, and we have to understand this. The biggest problem to understand is what is the presentation and what are the facts. Basically, the patients typically present with respiratory illness, that there is a dry cough, fever is there, and shortness of breath occurs later. And all the preventive measures that we are taking place and discussing is through the our experience of having SARS in the year 2003, and in that we had given some measures to understand and to uh, really uh, preventive measures were adopted through that, and the same preventive measures are being adopted today. Till date, there is no vaccine of this coronavirus of the 2019, and it will take around a year to get a good vaccine for that. Thirdly, there is no medication available for this disease, only symptomatic treatment can be done. Fourthly, in the SARS virus, that is also a coronavirus, 20% of the medics were affected. So there were about 8,000 people were affected. Out of that, 2,000 were medics. So we all can also be affected by this. And since I'm an ophthalmologist, I would like to discuss with you all about the problem that we have in ophthalmology and how to prevent ourselves from getting the infection. So the problem in the eye that occurs is usually conjunctivitis, or there could be a conjunctival congestion. Only in these patients of coronavirus infection, which is after the experience from the epidemic in the China. The problem with the ophthalmologist is that we have to be very close to our patients, and we rely on basically the physical examination and proper consultation with the patients, and there is a lot of discussion to be done with the patients. So that is a big problem, and so therefore the proximity increases. And as you all know that if somebody sneezes, it goes up to 6 meters. So we have to maintain a fair distance, and which is usually said that it should be 1 meter from the patient. The secondly, whatever problem is there, as I've already said, that we have learned through the SARS coronavirus epidemic, and we'll be discussing that. And through that, we came to know that the tear can be affected and infected, and through that, the ophthalmologist can get the virus infection. So we have to disinfect our instruments on a daily basis, which is very, very important. And we have to follow the exact need that is there for further development of disinfection. And we must have a personal protective equipment protocols in our ophthalmology clinic, which is so very important. Now, what measures you will take in your OPD once this attack has already started in India? It's in the second phase, which means that it might go into the community very soon, and we have 30 days window in which we have to take all the care so that this does not spread. So what we are told that we have to postpone the outpatient visits. Even in Shankar Netralaya, they are postponing the outdoor visits of the patients, and they are telling their patients to reschedule their appointment so that they can come at a later date. And who are the patients who should be avoided? And so you have to take the history there in the OPD. Somebody has to take that history, the respiratory illness, fever or cough, and a person who has returned in the last 2 weeks from an area which is having a high risk area. So that can be there, and then you have to reschedule their appointments in any case, and they should be told to come after a fortnight. So that you have to take care of, and if it's too many patients are there, then you can refer them to your close by friend who can see them and can advise them properly. Secondly, what they have advised is that you should keep your waiting room as empty as possible. So it's not easy to maintain the emptiness in your clinics, but it is very, very prudent to do this. Otherwise, you are going to have the infection and you might be spreading the disease to all your patients that is there. You have already seen that in the High Court, in the Supreme Court, in the airports, in the restaurants, in the malls, everywhere there is restriction to the crowd that is always assembled there. So we have, and in our OPDs, in hospitals, in government hospitals, in private hospitals, there is always a crowd. So we have to take all these precautions. That is very, very important. And in ophthalmic care, only when you get a urgency or emergency is there and the patient comes to you, then if patient has already had this infection, then he should be referred to a place where the a hospital has a good setting of infection control. There you should examine them with full personal protective equipments, and that is there. Examination, when you are doing examination, then that is also another important feature that you have to take care of. One must speak as less as possible with the patients, and you should tell your patients that he has to also refrain from talking, and he should sit at a distance so that you don't get the virus from them. Now, for elective surgical procedures, and as we all know that the cataract is always elective surgical procedures, the American Academy suggests that they follow the American College of Surgeons, and they say that they should be prepared to adjust their surgical volumes as the local circumstances dictate. So that means that you have to give the waiting list to your patients, postpone the surgeries for at least a fortnight, and the number of the surgeries should be reduced so that the infection load is also reduced in these patients. So the elective surgery, that means the routine surgery that we do, should be postponed as far as possible. And bigger hospitals have started doing, like Shankar Netralaya has already advised that these elective surgery should be postponed as far as possible. How to clean your environment and disinfect the clinic. So rooms and instruments should be thoroughly disinfected. How do you do that? The cleaning should be done properly after wearing the gloves and after wearing the mask and having a goggle on your face so that the infection does not spread, because the virus remains on the surface for around 12 hours. So you have to clean this, including the breath shield that has been advised by some ophthalmologists in the slit lamp. That should also be disinfected, otherwise you're likely to get the infection. Then what is used for cleaning the rooms? This is about the diluted household bleach, which is put about 5 tablespoons per gallon of water is put, and through that you can clean the surfaces, or you can use a alcohol solution with at least 70% alcohol, because it should not be less than that, otherwise the surface and instruments cannot be cleaned properly. So that care has to be taken. All this has been advised by American Academy of Ophthalmology and the journals that I have already mentioned to you. And for the personal care, this is advised that you have to have a 95 N95 mask, which covers your mouth and nose both. And for eyes, one must use goggles so that it does not go into your eyes, the virus. And you touch, because what happens that we keep on touching our face most of the time, and that creates a problem. That leads to infection. And breast shields has already been discussed. That is very, very important, and one must keep on with the slit lamp. So these are some of the care that we have to take, and once we understand this, we'll be helping the society, the community, and the government also in preventing the infection and the spread of the infection. Thank you so much.